And thank you for having us. I'm Niki Conte from the Massachusetts Health Connector, and I will be sharing today information about how to get health insurance coverage um, in Massachusetts. In particular, if you are looking for coverage for yourself or your family, or if you are operating your own small business and you need to have a better sense of what kind of options may be available to you. Um, so this is a really important time. And again, grateful that I can give the presentation now. I'm going to try to keep it to under 30 minutes. So Kelsey, if you and Richaline just want to keep me on time, because thank you, I can talk about this forever. But I think it's really important to give you the high level information and then get to your questions so that you can take action or make updates and ensure you have coverage for January 1st. So with that, I will explain what the Health Connectors Open Enrollment is. I'll talk about what this means either as a member or somebody who's newly applying. So in either of those situations, what needs to be done. And then as we're looking ahead to 2024, I'm going to talk about the features that are going to be new. So this is a really exciting time for us in that we received additional state funds that have allowed us to increase our subsidies for people and increase the income limits so that people who are in higher income ranges can actually qualify for more help. So very excited about that. And then I'll show you some tools that we have so that you can compare your options and choose the best coverage that's going to be available for you. And of course, everyone, we're always looking to save money, so I'll talk a little bit about that as well. So for those of you who aren't familiar, I'll just very quickly tell you who the Health Connector is. So we're a state agency and we're quasi-public agency, and we're the state's health insurance marketplace. And essentially we're here, we've been in place since 2006, since Chapter 58 was passed. And essentially we're here to help individuals, families, and small businesses access affordable health insurance coverage, but also more easily compare options. So if you're wondering exactly who gets coverage through us, it's really people who don't have access to health insurance from another source. So let's say you don't have access to it from a job, from a spouse, a partner, etc. And again, a lot of people who apply through us do get help paying for that coverage. I'll explain this as we go through the presentation, but the state's Health Connector is different from Mass Health. We're separate, although we are very close entities. We're like sister agencies. I talk a lot about health coverage, but I think it would be a big miss if I didn't talk about dental coverage. Individuals can also get dental coverage through us. And then if you are a small employer in Massachusetts, we also have a platform known as Health Connector for Business. So if you are, a non-family business, with fewer than 50 full-time employees, we do have coverage options through this Health Connector for Business. And I'll talk about that as well. So I will give you just a little bit of insurance speak for one moment, and then I promise the rest of this I'm going to try to make this as, user-friendly as possible. But just a few things so that as you're thinking about health insurance coverage, or you're thinking about what types of coverage we offer through the Health Connector, I think it's just important to note that all the plans that are sold through the Health Connector meet state and federal standards for coverage. So as a consumer, what does that mean? First of all, you know that you're going to get comprehensive health insurance benefits. It's going to include, all the coverage is going to include essential health benefits. So you will have coverage for doctor's visits, you will have prescription coverage, you would have emergency coverage. There's a lengthy list, we'll share it with you, but just know that all of the plans meet state and federal coverage for state and federal standards for coverage. And in Massachusetts, we do have an individual mandate that requires most adults to have health insurance coverage. So you would never be penalized for having coverage through the Health Connector. So all of these plans are known as qualified health and dental plans. I think what's really important for today's presentation is to talk about health plans with advanced premium tax credits and our connector care plans. Now, these are the two ways in which people can now save substantial money when they are getting coverage. So for the advanced premium tax credits, coming through the Health Connector is the only way that somebody can access those tax credits because we're the marketplace. And then also the Connector Care program. We have gone through an expansion, particularly for beginning in 2024. This is a pilot program for 2 years, which essentially is going to make more people eligible for more savings. So I mentioned that this is an important time because we're in the middle of open enrollment. So really quickly, what does that mean? Open enrollment basically is the time of year where someone can come in and shop for coverage, and they're not going to need any type of reason to come in, apply, and enroll in coverage. If you just haven't had coverage for whatever reason, or a friend, relative, etc., just let them know. It's kind of open season, and that's going to run from November 1st through January 23rd. Now, what happens after that when we get into a closed enrollment period is if somebody is seeking health insurance after that date, essentially they're going to need to have some type of qualifying life event. So this slide really just says what I said. Basically, you can come in now. You don't need a reason. You don't need to provide any proof. Just come on in. If you are new to the Health Connector, you can apply and you can still get coverage. That's going to start on January 1st. Really important, I said that we are not Mass Health. However, we are very closely tied to Mass Health. So if you apply for coverage, there's a variety of reasons why somebody may qualify for Mass Health. So if you apply for coverage, you're going to be, your application is going to be reviewed and you will be found eligible for whichever coverage is going to be best for you. So sometimes people find out that they qualify for Mass Health, and that coverage starts immediately. Now, all Health Connector plans start on the first day of the following month after you apply. So right now, you can shop for coverage that begins on January 1st. If you came in January, you would be shopping for coverage that began on February 1st, etc. Now, getting right to it, whether somebody is a new member or just coming in, I just want to make you familiar with what our application website looks like. So as I'm going through this presentation, if you want to take a minute and go to mahealthconnector.org, you can. From that page in the upper right-hand corner, it will say like apply or log in, something like that. I want to acknowledge that once you do click on that, you are brought to this application screen. Our application is also available in Spanish as well as Portuguese. So if you would prefer to go through the application in a different language, you absolutely can. And I think the most important things to point out on this slide is that you have, you're being asked to either sign in or create an account. So if you have ever applied for coverage, I would say try to sign in. If you don't remember your password, username, that's okay. Use the forget password, forget username. Try to get back into your original application. That's really important. And by getting into that application and not creating a duplicate account or duplicate application, you're really going to save yourself time, because you just need to update parts of your application, but also save yourself trouble from kind of locking yourself up, because there can only be one you, because we're looking at a lot of your personal information, so your social security number, your income information, etc. So really important to try to get back into any application if you would ever apply. So if you are an existing Mass Health member, Health Connector member, or maybe you had applied before, just not sure, all we need you to do is update your application. So don't create a new one. Update it with any of your information. Maybe you've moved, maybe you have, you've had income changes, maybe you have a couple of side hustles, absolutely anything. Just try to get to that original one and make those modifications. If you have never applied for coverage before, you can start by completing an online application. Now, this is where I always plug that we have a lot of in-person assistance and phone assistance that's all for free. So whether you are doing this on your own and you get all the way through, or you start this and you get stuck in any way, somebody, once you give them approval, they can go into your application with you and help you get across the finish line. So again, if you're existing, just update. If you're new, you complete the online application. Now, when you get to the end of the application, what's going to happen is you're going to get an eligibility result. And you may find that you have a result and it says you qualify for connector care, let's say. But your income information that you provided us, there was a little mismatch maybe. Maybe you made more money last year than you made this year. So you might have to send in proofs. So you're going to have 90 days to send that information into us. But it doesn't matter. You'll still be able to get into your health insurance coverage. You just have to complete those actions. You've got to send in those proofs within those 90 days. Now, the third step in this process is to shop, compare, and enroll in a plan. Now, really important, whether you're new or an existing member, if you're an existing member and you're comfortable with the plan that you're in, you don't have to do anything. You can just stay there. You'll get a new bill this week and just pay that bill by December 23rd. And the coverage is going to continue on January 1st. But if you are a new member or you want to shop for something new or different for next year, you need to take action by December 23rd so that your new coverage can be effective on January 1. So if you have been getting any communications, if you've been with a Health Connector at Mass Health, I'm sure we have bombarded you with messaging. And that messaging really is just to let you know that it's time to renew coverage. So we've got official notices, we've got other types of flyers where we're essentially just outlining what you need to do, what are your deadlines, and links to how you can get more information. Now, this part is really critical too. And we always like to spend a little time talking about income. And really that's because we don't want anyone to, go through this process and then have a surprise at the end of the following year when they file and complete their taxes. So as I started to mention at the very beginning, was that we are the only place somebody can access advanced premium tax credits. And those advanced premium tax credits are one of the ways in which people save money on their monthly premiums. And you would get, or somebody would qualify for those advanced premium tax credits based on their household income. And when we're talking about income, we're actually talking about someone's projected income for the current year. So when you're completing the application, it's a little bit easier right now in December because if you're being asked for information about 2023, you can kind of look back in your records and say, okay, how much did I make? Okay, great. Now, giving the correct amount is going to help you get the most tax credits and help paying for your health and dental. And then making sure that it aligns as closely as possible to your taxes is going to help you so that come tax time, everything aligns and you do not end up owing federal dollars back. And in some instances, you might even get more dollars back because of these tax credits. So now I want to talk about this new help that's available. So earlier I mentioned the Connector Care program. And that way is, well, Connected Care is unique to Massachusetts. And essentially, this program is a subsidized health insurance program. It has lower copays, no deductibles for its members. Earlier, Richaline put a link into the chat regarding our collaboration with the Mass Cultural Council. So there is a Card to Culture program. And once somebody is a Health Connector Care member, they have the ability, so totally separate. I just want to acknowledge it that way. They have the ability to access um, programs and access to cultural institutions across the Commonwealth. But that's just, another way of keeping someone healthy, right? And another aspect. So I'm so glad Richaline mentioned that. But this Connector Care program is one of the ways in which it's essentially of a more affordable cost to people is because it has the federal subsidies plus state subsidies. And again, I had talked about, all of our plans meet state and federal coverage or standards. So you might be wondering, okay, how does this work? So I will share that if you qualify for a particular amount of premium tax credits, those dollars get sent directly to the insurance company that you enroll with. So you just simply pay less each month. And then depending on how much you qualify for, you as a consumer can decide, do I want to apply all of that tax credit to get that lower monthly premium, or do I want to, cut that back a little bit? Then there is the Connected Care program, right? So some people could just qualify for advanced premium tax credits where they apply those tax credits to a particular health insurance plan. But with the Connected Care program, it's a combination of those advanced premium tax credits plus state dollars. Together, those reduce the monthly premium amounts. And depending on the plan type a person qualifies for, their monthly premium could be as low as $0 or up to $255 per month. So it's really dependent upon which plan someone chooses. Now, for this year, we're really excited to share that all the insurance companies who participate on the Health Connectors website also participate in the Connector Care program. So that will be beginning on January 1st. So we have Fallon, Health New England, Mass General Brigham, Tufts, WellSense, Blue Cross Blue Shield, Harvard Pilgrim, and United Healthcare. And if you go onto our website right now, you'll be able to see those plans. So in terms of actual dollars, I think it's really important to think of this, for let's say one person, because we've had this increase in income limit. The income limit used to be 43,470 for a single person, but now that income limit has gone up to 72,900 for 2024. And for a family of 4, the income limit was 90,000, and now it's up to 150,000 for 2024. And as I mentioned, there's going to be a range of help available, and there is a range of plans that someone can enroll in based on the plan type. And the way it's organized is that each plan type has someone has the opportunity to enroll in the lowest cost plan. So as you can see here in plan type 2B, for example, the lowest cost plan is $49 a month. And as somebody's income goes up, and I'll just look at 3C for a moment. If someone chose to enroll in the lowest cost plan, that would be $219. Okay. Now, I want to spend just a few moments talking about how to shop for coverage, what tools we have, and then really how you can save money. So very simply, there is a premium amount that people must pay. So that's the monthly amount somebody pays to be in this plan. For those of you who are less familiar with health insurance coverage, an analogy we like to use is like paying for a gym membership. You commit to it, it's due every month, whether you go or not, but that's your monthly premium. Now, because you have chosen this plan, you're going to get a set of covered benefits. And these are all of the services that are available through your health insurance plan. Now, although you pay a monthly premium, certain services are going to require an out-of-pocket cost. So that's simply just the amount that you as a member would pay for a service. So depending on the plan you choose, you might have, lower out-of-pocket costs, or you might choose to go with a plan that has a lower premium and a higher out-of-pocket cost, because maybe you don't go or use your coverage that often. And then lastly, the thing that the aspect of health insurance coverage that essentially influences the cost of your plan is the network. So the network really are the doctors, specialists, hospitals, facilities that contract with that plan. So typically, the smaller the network, the less costly that insurance plan is. But again, if you are using a lot of services and you need a variety of doctors, specialists, etc., you may want to go with a plan that essentially has a larger network. So I mentioned that we have tools. Whether you are newly applying or you're coming back to the Health Connector, you can go to mahealthconnector.org and it's /renew. And on this page, you're going to be able to access all of these tools. You'll get information so that you compare your plans if you want to from last year to this year. You can do a search to find particular providers or even prescriptions. You get some guidance on signing in and then also guidance on paying your monthly premium. And these are the tools. So if anybody wants to do this right now and they're thinking, okay, could I in fact qualify for some savings? You can go to our website, mahealthconnector.org, and at the very top left, or I'm so sorry, middle of the screen, in the toolbar, it will say get an estimate, and you'd want to select individual if you want to get an estimate as an individual or a family. And you can just enter some really basic information. So enter information about your zip code, the number of people in your household, and then also just a guesstimate of your income. And you'll get to see the plans that are available in your area and an estimate of the monthly premium and the savings available. Now, if you're trying to find out if a particular doctor or specialist or even a hospital or health center is part of a plan, you can use our plan comparison tool. And then both of these tools, when you are so those tools that I mentioned, you don't have to be in your application. You can do that outside of the application. You can just go there and, go to these links and you can see, find out some information. But when you are in your application, you're able to use the plan finder tool, which basically lets you see all of this information. You see pricing, you see, you can find out if a particular physician or medication is covered. So that is, again, available when you're in the application and outside of the application. Now, I mentioned this earlier, but it's always helpful to just remind everybody is that if you owe a monthly premium, your enrollment isn't complete until your payment has been received and processed. So the most important deadline is the 23rd of each month. So for coverage that begins on January 1st, you really want to take all your action by December 23rd. We just started sending bills this week for December coverage. And again, if you are an existing member, this bill is going to be based on your program eligibility. So all the information that we have available. If you are an existing member and you want to switch, you still have time. You can switch plans. If you don't have health insurance coverage and you want to explore some options, you also still have time. So again, this is all available to you for January 1 coverage. You can take action until the 23rd of this month. And on this slide, I just wanted to point out what a sample bill looks like, and then also explain the different ways that you can make payments. We do accept online payment, and that payment only can be made from checking or savings. We don't accept credit card at this time. You can pay by mail, and we have a relatively new pay by phone option. So want you to be aware that that is also available. So I've shared a whole lot of information, and for some of you, you might be thinking, okay, this is great, but I really could use some help as I go through this. We do have a customer service center as well as community partners across Massachusetts who can help you with this process. Customer service, our number is 877-623-6765. And, you can certainly call them. During open enrollment, we have extended hours and also some Saturday hours. So certainly take a look at our website and we can get you that. You'll see that information. We also, because it's such an important time for ourselves and our colleagues at Mass Health, we have a number of community events. So you can go to our events page. If you go to just mahealthconnector.org/events, you can see kind of where we're going to be over the next several weeks. You can get help at these local events, or you can seek assistance from a trained and certified navigator or certified application counselor. And these are folks that work at community organizations, hospitals, health centers, and they can offer help in languages other than English. So if you would prefer to talk to someone in another language, you can click on it says get free help near you. You can click on that and enter a zip code, and you can scan and see, what language support is available for you. It's also worth noting if you call customer service, they can also assist people in a language other than English. It just may be if someone is not available who speaks that language that day, you may need to use a translation service. They have a language line. All right, so I don't know how I did for time, but I am happy to take questions. Did I do okay for time? Because I can.
It was perfect. I was keeping track, and I think you had about 3 more minutes if you wanted them.
Okay. So yeah, happy to take any questions that people have. I think some folks, Kelsey, would you like me to just go through what people put in chat, or would you like to go through them?
Sure. It looks like you got a couple of questions from one individual in the chat. And then after that, if anyone else has questions, please feel free to unmute yourselves and we can go from there.
Okay. So these are great questions. So there is a question around, let's say a couple, if a husband has Medicare now, and has insurance, how should you think about the income, the household income? So just generally, when you are adding or you're answering questions about income, you do want to tell us about the household income. And if someone is married, even if the other person is getting Medicare or getting coverage elsewhere, you want to, or in order to receive advanced premium tax credits, the rule is that you do need to be filing your taxes jointly. Now, if your income, if you take the two incomes, as you're going through, you're going to provide household information. You would just essentially, for the person who has Medicare, you would just indicate that they do not need coverage. And then let's just keep going here. And actually, before I move on from that, is there anything else I want to say about Medicare? Typically, maybe I do want to say this because other people who are on today's call might be in this situation. Typically, we suggest that if you're a couple and one of you is older than the other, or getting closer to Medicare age, we like to recommend that the younger person becomes the head of household, and then the older person is kind of second on the application, so that if they when they enroll into Medicare, the person who is still, needs coverage kind of just stays as the head of household and doesn't have like any type of, fluctuation in their coverage. The person just kind of goes off to Medicare, pardon me. And then here's a situation which I think some people really might be in right now just because of COVID and Mass Health renewals. So this person says, I had Mass Health during COVID. They got a letter that coverage ended 2 weeks after the date. So it was 1 month without insurance. I was told by Mass Health that they had to see the doctor, paid out of pocket, told by Mass Health that I could get covered for that month retroactively. Submitted paperwork. How do I find out and make sure that it was extended? Okay. So although we don't work for Mass Health, I feel comfortable just explaining this because we've been working with them and talking about this Mass Health renewals process. So essentially, during COVID, people were protected in coverage, and if you had that coverage, you stayed protected until April of this year. Now, Mass Health is going through a massive renewals process where they're essentially just checking and going through and ensuring that people are, many people have, moved on, gotten other coverage, but some people still need the Mass Health coverage, etc. If you had Mass Health and you're in a situation where you still may qualify for Mass Health, although the coverage ended, what you need to do is, first of all, you need to update your application, and then you can contact the Mass Health Enrollment Center and you can ask them for a reconsideration if you believe that you should have had Mass Health and you should have been covered for those services that you received. So let me know I'm hoping that helps to answer your question, and let me know if you can, if you want me to go any further with that. This next person says, we're a small nonprofit music school. Wondered if you could address coverage for our part-time faculty. Absolutely. So when I talk about who can get health insurance coverage through the marketplace or the Health Connector, it's really those who don't have access to health insurance coverage. So if you have part-time staff at your school who are, because of the rules of your insurance coverage, they don't qualify for those benefits, they can certainly come to the Health Connector. They're going to need to include information about, their household income information. Since you don't necessarily know maybe what all their situations are, that's fine. They can go there, enter their information. And if in fact they qualify based on their income and other eligibility factors, absolutely, I think we'd be a great option for them. All right, there is a question about what is a qualifying event outside of open enrollment. So I can send a link, or even, and maybe Kelsey and Richaline, I can give this information to you when you do the follow-up email. But we have a number of qualifying events. So I can give you examples such as, income going up or down, someone getting married, someone getting divorced, someone losing health insurance coverage. having a baby, adopting a baby. So it's really comprehensive. So there are a lot of ways in which, if you are outside of the open enrollment period and you have life changes, even moving from one part of Massachusetts to another part of Massachusetts is considered a qualifying event, because the health insurance coverage that, let's say, you may have had if you were living in southeastern Mass is different, right? The networks are different out in Western Mass. So there are a number of qualifying life events which would allow someone to come in for coverage after open enrollment. Let's see. If you qualify for connector care discounts, does it apply to each of the connector care plan options, or does the discount only to apply to a few of the plan options? Okay, that's a great question. So if you go to our website and you go to the Get an Estimate tool, if you plug in some of your basic information and your zip code, you are going to see, you could potentially see like 7 results, right? And you're going to see that you qualify, let's say you qualified for $475 a month of advanced premium tax credits. Now, that's great. You're like, okay, that's consistent. But boy, there's a range. There's a range of what that premium could cost if I decided to enroll in Plan A, Plan B, or Plan C. So that APTC discount absolutely gets applied. It's the same discount. It gets applied to any of the plans from that list that are available in your area. However, that plan's cost might be different at the start. So they could be starting with a higher premium amount, so that if you wanted to select Plan B or Plan A, you just got to compare what they're originally charging. Now, what's really great about connector care, there are a lot of consistencies. So if you qualify for connector care, there are no deductibles. You never have to worry about that. If you qualify for connector care and you qualify for a plan type 2A or 2B, your benefits and copays are decreased. They're much lower in comparison to like what the commercial standards are. And it doesn't matter which plan you enroll in, whether it's plan A, B, or C, those copays are going to be the same across the board. So you have very low prescription costs. In some instances, you have $0 prescription costs, but that's consistent. The real thing that I can't really give a brand name over another brand name. That's not it. What's really behind the cost truly is the network. So these are personal decisions. So depending on your own situation, if you, let's say, have particular doctors or particular hospitals that you do need to keep a relationship with, that's where you want to make sure that the doctors are in the network of that carrier that you want to enroll in. And then also there are instances where people are taking very specialized medication. You want to make sure that that medication is covered in that plan. So you may say, oh, this is $100 more a month, but you know what? They cover that specialty medication. So again, everybody is in different situations, have different circumstances. So I think I'm hoping that this helps explain in a very basic way, like why something would cost $200 more if I'm getting the same exact thing. And it's really because there are nuances with the network and medications, prescription, formulary. Sometimes, and if I'm using too much insurance speak, let me know. Let me just go up a little bit. I feel like I missed. Okay, one question here is if you've got unemployed in the month of 2023 and want to apply for health insurance for 2024, how can you prove not having income? I mean, all is Okay, so if you're looking at, I think I'm gonna just modify this question a little bit and tell me if I'm getting to what you are asking. So when I was talking about income, I mentioned that you are, actually, maybe I didn't mention this, so I have to mention, when you're completing the application, you're going to be asked about current income, and then you're asked about your projected income for the year. In some instances, someone might have not been working for a couple of months that year, and then they are looking for coverage for 2024, right? And all of this information is going to be different than the tax information they had in 2022. So how exactly do you prove all this? So if you you really need to have a good estimate of what your income either was or is. Um, any tax documents, and now I'm so sorry that there's a particular schedule. It's like I'll try to get it before I get off this call this morning. And if it doesn't come to me, I will email it to Kelsey and Richard Lead. I'm so sorry. But there's if you are a dependent contractor, there's a schedule that you need to submit with your taxes, right? Anyone help me out, because I just can't remember what it's called. But any proof that you have of what your income was. If you were unemployed for a period of time during the year and you were collecting unemployment, you want to include unemployment income. And essentially, what it comes down to is you kind of just figuring out the estimate. We also have worksheets that you can use. And if you call customer service, they can help you figure this out. And it is entirely possible and very practical that what somebody made in 2023 is different from what they made in 22 and what they're going to make in 2024. I feel like my response to this one was not very clear, so let me know if if there's like something specific that I can better.
Nikki, do you hear me? I mean, I don't know, I unmuted myself.
Perfect, yes.
I think my question was much, much more simpler than that. You know, you get unemployed, I got unemployed in May, and let's say, sure, they ask for an amount, and there's no date. They say, from what date? So I put from May 1st, 2023, let's say I'm making like just a tiny little amount of money. And I think that's going to be my projected for 2024, and that's it. But then that's it, basically, you know, that there's a note that says, oh, we see a discrepancy because obviously they're looking at my tax return from 2022, but that's it. I mean, that's it. I'm projecting the same thing for 2024, and that's it. My point is that I just don't want to do anything illegal. If at the end they come and say, oh no, you are not eligible for anything, I'm fine with it. But at least I want to make sure that this is it. It's just that I don't have any income after I got unemployed, and that's it.
Absolutely. So I completely appreciate you, like you're saying, okay, I want to apply and this is really what's going on, but you don't want to be in a situation where you're getting into some kind of difficulty later. So if you have a reduction in income and there's just no way, I guess it's if you get where it says we need additional documentation, if there's any way to document or show that that income has gone down. So if you can share bank account information, any way to show proof, you know, that's would be suitable. And again, when we write back to you, I'll share some links which you can see very specifically. Here are the types of things that you can provide as proof. But if you can also, I know during COVID we allowed for a self attestation, like a letter that's saying I'm explaining that my income has changed and this is why it has changed and this is why it is different from 2022 to now. I believe we're still accepting those self attestations. but absolutely it's possible that it's just different. And as you're looking into 2024, you're anticipating that that's what it's going to be as well.
Sure. And I assume I can just apply and submit, and if they need more documentation, they will contact me, because there was nothing, like it was just a button to submit. I just didn't click the button, but that was it. So I will submit with my word. And I wanted to make sure not to be signed up for anything. I just want to find out what I am eligible for. Do you see what I mean?
Yes, so you just made two really good points, and I'm so glad you've asked these questions. I'm so glad you unmuted yourself, because so two things. One, if you're in the application, you have the ability to upload documents as proof. So you can get that information to the state as quickly as possible. And then the next thing you just said is really important to mention to everyone. You can complete an application and not sign up for anything. There is zero obligation. Like, you can go through this whole process and be like, all right, this is good. This is what I qualify for. Do I want to do this or not? If you ask me, I work at the Health Connector, so I'm going to say, no, I want you to be healthy. Please sign up for coverage. But if you decide like, no, I don't want to do anything right now, or I want to ask some more questions, that's totally fine. This is a zero, like, no obligation. You can come in, you can use the estimate tool, and that's the fastest way you can see what you could qualify for. But if you take the time and tell me if I'm saying your name correctly, Tayabe?
Yes.
Okay. If you take the time to complete an application, you know that it takes at least 45 minutes to an hour to go through it all. So if you take that time to do that, also know that still at the end, there's no obligation. You're not tied to anything.
Although there was a checkbox to uncheck, because if not, you would have been automatically signed up. But that's okay. My last question.
Oh, that's something else. Can I explain that to you so that others know as well?
Oh, sure.
Okay, so we've been doing this for the last couple of years. There's a checkbox that says or asks you as a consumer, would you allow us to auto enroll you into coverage if your income goes up or down, right? And some people check that off because that's great. That means they are like, you've applied for coverage, and let's say your income goes up or down, and let's say you could qualify for a lower cost plan, and they're like, yep, auto enroll me in that lower cost plan. Thank you so much. All right, that's essentially what it is. And like you're saying, you can uncheck that box and say, no, please don't auto enroll me into anything. I want to be proactive and make that decision.
Okay. And finally, you only talk about premiums that go from $0 to $255 per month. I mean, depending on what you are eligible. But you don't talk about deductibles, and that's the thing that makes the final decision, because if I have a $12,000 of deductible, no thanks. I mean, it's not worth it. I mean, I'm basically wasting a monthly payment.
You are asking all the best questions. Thank you so much. So, all right. So I've been talking so much about connector care programs because I feel like the income ranges have gone up so high that so many more people are going to qualify for connector care. Connector care plans have no deductible, zero deductible if you qualify for connector care. So that's a huge financial savings for people. So that I want to assure you, if somebody qualifies for connector care, there is no deductible. Don't have to worry about that. However, if you don't qualify for connector care and you qualify for advanced premium tax credits, you are then going to be looking to apply those premium tax credits to a plan. And absolutely, you need to think about, all right, what are the out-of-pocket costs that are associated with this plan? So is this plan a $5,000 deductible? Does this plan have, what are the cost sharing? So when you are looking at our plans, they're organized. Forget connector care. Let's say your income's above the connector care limits. You are going to be looking at health connector plans, and they're organized into bronze, silver, gold, platinum. And the easiest way, there's this whole thing called actuarial value. You really don't worry about that, other than as you go up in tier, you pay more out of pocket each month, but the plan covers more. So it's kind of like, if you know that you're going to be utilizing a lot of services, you might choose to buy a high premium. You might choose to buy a platinum plan. But if you are saying, you know what, I really don't go to the doctors that much, I'm relatively healthy, I can buy a bronze plan and I can take on, you know, a $5,000 or $7,000 deductible, right? So it's really a financial choice combined with like your own personal situation. So these are great questions. I'm so glad you brought them up.
Thank you so much. I assume connector care is the old Mass Health, what we call Mass Health, basically.
No. I feel like I put you like we planted you. I swear we didn't plant you. These are great questions. No, so the connector care, so Mass Health still exists. Mass Health is available still, and they have a variety of programs. I can't even begin to I can't even rattle them off, like there are so many. But it's really important to at least acknowledge a couple of the main categories. So Mass Health has programs for individuals who are in lower income brackets, also people who have HIV, breast and cervical cancer, pregnant moms. So Mass Health has a variety of programs. Even for those over 65, there's a Mass Health buy-in a senior option buy-in. Again, can't rattle them off. If you have any questions about Mass Health, you can go to mass.gov/Mass Health. Tons of great information in their member booklet. The Health Connector, without going into the history too much, essentially was born out of like the need in Massachusetts for people who were over income for Mass Health, who just essentially didn't have access to health insurance coverage. So we started because the Commonwealth has a lot of people who are gig workers, who were working a number of part-time jobs, just essentially, you know, trying to make ends meet, but don't have access to health insurance coverage. So we are separate from Mass Health. We just partner closely with them. Does that help?
Yeah, I went to Mass Health and it kind of redirected me to, like, I just went to masshealth.gov and wanted to find out if I'm eligible or not. And now that you told us the threshold, 72,000 plus, I mean, obviously I'm eligible, I mean, no doubt about it. But then it redirected me to Mass Health Connector. It wasn't my choice. I discovered it, like, you know, just by trying to fill out an application. That's why I say, is it the same thing? Thank you for differentiating it. But anyway, I'm going to just go and fill out the application. But
we share an application. So I feel like there are a couple of other questions. So if it's okay,
sure. Thank you.
Kelsey, can I go to the others and we can come back if we have to? I don't even know what time it is.
Yeah, well, actually, we're at time.
Oh gosh, okay.
No, this has been great. You've shared so much information and answered so many questions. So I'm sorry to the people who had other questions in the chat, but Niki, we will share out the slide deck, and that includes contact information. So if you have more questions about the Mass Health Connector, you can contact people on the hotline who can give you the same sort of information. But Niki, I don't know if you have any closing comments before we stop the recording and the webinar for this morning.
I do. So first, I just want to thank everyone for taking the time out of your morning. Great questions. since we are in open enrollment, we do have regularly scheduled webinars. So if you go to our website, we're actually having another 1-hour session for the general public next, I believe it's next Tuesday around noontime. You can see all the details on our website. So if there's something that you're like, let me just hear that again, you're welcome to join that. Take a look through these slides. But Kelsey, I think I want to rely on what you just said, which is we have tons of support either through customer service or community partners. So if you have a very specific scenario, I would reach out to one of our local experts and they can help you get across the finish line. So we're always here, just happy to invite us back whenever you'd like, and happy to answer any other questions that come up.
Thank you again, Niki, so much for joining us this morning. And thank you everyone else too for attending our December Policy in Action webinar. Again, we'll follow up with an email with more information on the Health Connector and some other updates that we want to alert you to. If you have any other questions for MASSCreative, you all know where to reach us, and you can email us at our info@masscreative.org email. All right. Thank you. Have a great rest of your day and weekend.
Thank you so much.